everyone. The spreading of disease began at Petaling Jaya. The total number infected was 300 cases. The most infected area is at Kampung Baru and slightly occurred in Taman Hunde near the town.
Well, actually diphtheria has been around for quite a long time. Diphtheria is actually a severe bacterial infection caused by Corynebacterium diphtheria. Interesting fact is, this bacteria itself is not bad, but it has to be invaded by the virus. This allows it to produce toxin, which really actually caused the severity of this diphtheria. The disease was first developed in 1880s, but then the vaccine was produced in 1920s. The implementation of vaccine has dramatically decreased this diphtheria. However, we encountered this outbreak because our vaccination program has went.
Sorry to interrupt, but how has the progress in the diagnosis?
So far, the suspected patient is a sick child who has a sore throat with a grey membrane covering the tonsils and throat. The sample will be taken from the throat membrane to be diagnosed. The growth of this bacteria needs a special media. We can also take a sample of tissue from an infected wound and have it tested in a laboratory to check for the type of diphtheria that affects the
How
skin.
and why these outbreaks happen suddenly? I'm very concerned because this outbreak has caused commotion in our community.
Diphtheria spreads from person to person through the close contact with the discharge of an infected person's eyes, nose, throat, and also skins. Signs of the symptom can often happen between 2 to 5 days after the infection occurs, but there's also some people who experience no symptom. Some of the people who experience symptoms which is very mild, such as common cold, and the most visible and also common symptoms will be they will have a thick grey membrane on the tonsil or on the throat. I believe that this outbreak occurs because one of the earlier patients, Siti Saleha, carried this disease from Indonesia, and is supported by the fact that Indonesia has the most affected country for diphtheria.
How can we prevent it?
Although it spreads easily from one person to another, but diphtheria can actually be prevented by the use of vaccines. The vaccines for diphtheria, tetanus, acellular pertussis, DTaP, and is given in 5 series. It is given to children especially at the age of 2 months, 3 months, 5 months, 18 months, and also at the age of 7 years old. This vaccine is available in our country, but we really need more supply. The new stock will come within these few days.
What are the treatment available for us? Our resources is quite limited since this is the first time we encounter this outbreak.
The mainstays of treatment for diphtheria include diphtheria antitoxin, antibiotics, and also supportive care. If diphtheria is suspected in a patient, treatment should be initiated as soon as possible, even before confirmatory diagnostic test results are available. This is to improve the chances of favorable outcome. Antibiotics are also recommended to treat this disease, but for now, our big problem is we have a short supply of vaccines and also pharmacies.
Based on the information I get, several people at Kampung Baru was infected first. Then the case drastically increased and spread to the other places.
I think what we can do now is we immediately quarantine those that are infected and treat them with antitoxin injection. But before that, we will make sure that they are not allergic to it, and also our doctors will prescribe antibiotics such as erythromycin and also penicillin to help clear out the infection. Other than that, we are going to give free vaccinations and to give especially to the children.
Besides that, we should also organize an awareness campaign so that our community are more informed about diphtheria and that there are free vaccines available.
I think that's a good idea.
I think that's all for today. Thank you for your opinion and advices. I hope after this the public will be more aware about this incident.
Thank you for spreading the news for us.